Hi there, Dr. Dani here. Today we're going to talk about degeneration in the spine. A lot of people think that degeneration happens in our spine because of old age, but that is actually a misconception. Degeneration occurs due to a lack of movement. This lack of movement is typically caused by a subluxation or other reasons, but in chiropractic we focus on removing the subluxations. So a subluxation is a bone that's moved slightly out of place, but it's not dislocated and it's causing improper or not enough movement. Degeneration happens when a joint is not moving. It's the lack of movement that causes degeneration, not just simply old age. So we're going to look at a few different patients and who've been under varying amounts of chiropractic care to kind of see how their spines have held up throughout the years. So in this very first patient, we can see that her curve is at 18 degrees. Sorry, this is flipped around. And we can see all those red arrows. Those are pointing to areas where the discs have degenerated. So ideally, you want to be between 35 and 45 degrees. This person recently came to us as a new patient, and she is 63 years old. So 63 years old is actually fairly young. As far as I would say, I don't think you should have some age-related degeneration at that point. All right, now I'm going to bring up our second patient. So our second patient has had some chiropractic care throughout her lifetime. But she's also had some spots where she did not have any chiropractic care. Now we can see that her neck is at 54 degrees, which is much closer to that 35 to 45 degree range where we want to be. We're not exactly there. And we can see that she does have a few arrows pointing to some areas of degeneration, but overall her discs are far more open. She has a much better curve in her neck and much less degeneration. She is actually 4 years older, she's 67, than patient number 1. And now we are going to look at patient number 3. Okay, so here is patient number 3. Now we can see we do not have any arrows pointing to areas of degeneration. We can see a nice smooth curve. She's at 34.4 degrees. The ideal range, again, 35 to 45 degrees is where we want to be. And she transferred to us as she was rehabilitating from a car accident. So she was already receiving some chiropractic care for this car accident when she transferred to us. So even after having a car accident, she was still pretty close to that range of 35 to 45 degrees and does not show major degeneration. Something you don't know about this patient, her mom was a chiropractor and she has been under chiropractic care her entire life. She is our oldest patient. She is 74 years old, and she has the healthiest or youngest spine of all the x-rays that we've looked at today. So if you would like to keep your spine young and healthy when you're 74 years old and tolerate car accidents and all the other traumas of life, it is important to stay under chiropractic care. In studies with mice, they see that adhesions start to form as soon as 4 weeks after a joint becomes locked up. And so this is why if you've been under chiropractic care for an extended period of time, your chiropractor likely recommends you coming in every 4 to 6 weeks to make sure that we are removing any of those subluxations and allowing your joints to move and to keep you young.